Hello, welcome back. Welcome back to the program. We hope you had a good break and are full of energy now to continue participating in the program as we shift our focus to special issues in pediatrics. And it is my distinct pleasure to introduce Dr. Jorge Becerra. He's the president of the American Association for the Study of Liver Diseases. He's also a professor of pediatrics at the Cincinnati Children's Medical Center. He is the William and Rebecca Blistereri Chair in Pediatric Hepatitis. He's the director of the Division of Gastroenterology, Hepatology, and Nutrition, and a medical director for the Liver Care Center and for the Digestive Health Center. Dr. Becerra, we really look forward to your presentation.
Thank you. I also want to thank PSC partners for inviting me to review the natural history, management, and treatment of PSC in children and adolescents. PSC, today I will briefly revisit key elements of the pathogenesis of disease so that we can better understand key features of pediatric PSC. I will use a couple of patient cases to illustrate how the disease manifests in children and adolescents. And then I'll focus on reviewing some unmet needs. We need better understanding of the clinical course of disease. We better define the impact of growth and development, and we need to really develop more effective therapies. PSC attacks the epithelium of both intra and extrahepatic bile ducts. Indeed, a small target, but with potential for major impact on the health of a child. As you can see here, if you do the biopsy of a child with PSC, you may find a typical feature of a pericentral fibrosis around intrahepatic bile ducts, as well as an expansion of the portal space with predominant infiltration of inflammatory cells. Children, like adults, can also have abnormal dilatation of extrahepatic bile ducts, and sometimes to lesser degree, involvement of intrahepatic bile ducts, as shown in this MRCP. Just like adults, the pathogenesis of disease in pediatric PSC involves genetics, and it's also greater prevalence in male, and also involves other environmental factors, but not like adults. We may have a more predominant impact of immunological factors that may drive bile duct injury and inflammatory reaction. This has been demonstrated experimentally in an MDR2 knockout mouse model, in which the investigators identified and demonstrated the leakage of bile, the development of pericholangitis and periductal fibrosis, as well as ductular proliferation. PSC is a disease that affects all ages, and probably the causes differ, as seen, for example, by the careful phenotype of children with PSC. They may have mutations in genes involved in the immune system. Perhaps in adults, there's a much greater contribution to the exposure of microbial agents and environmental toxins. Children and adolescents with PSC share clinical features like adult patients. They may have low-grade symptoms such as recurring abdominal pain, perhaps on the right upper quadrant, fatigue, easy bruising, different degrees of itching. Often they are diagnosed during evaluation of IBD, but they can also present during early childhood in what we call secondary sclerosing cholangitis. Defects, genetic defects in DC2 protein, for example, can lead to the protein deficiency, and the patients can present as neonatal sclerosing cholangitis. You may have other inflammatory diseases that can cause a similar feature, such as you can see with hemophagocytic lymphohistiocytosis, hyper-IgM syndromes, eosinophilic cholangitis, and others. Let me present to you a clinical case of a 3-year-old boy with features of fullness in the abdomen, and a history of intermittent abdominal pain. The boy had elevated liver enzymes, as you can see here with ALT in the 138, much higher GGT, and alkaline phosphatase between 600 and 1500. This is an MRI that showed the hepatomegaly and much greater splenomegaly. The biopsy was suggestive of autoimmune hepatitis. The child received prednisone treatment, but the improvement of ALT was not consistent. And further evaluation showed that the child had PSC. The child did relatively well and began to lose weight a couple of years later because of the development of IBD with severe symptoms, underwent colectomy and did relatively well. And then later in life, developed fatigue, had multiple splenic infections, and underwent liver transplantation. He's doing well today. This is the MRI done prior to his transplantation. As you can see, he had a giant spleen. In contrast, you have a 17-year-old adolescent with a 3-year history of PSC. He presented, was well-nourished, had no evidence of chronic liver disease, and his enzymes, again, were a mid-100, had a high GGT, normal platelet count, no evidence of neoplasia. His MRI, in contrast, had mild hepatomegaly, but no evidence of splenomegaly. His RCP would show both intra and extrahepatic biliary abnormalities. So several papers have documented that pediatric PSC is different than adult PSC. And I list here 3 of them. They do document there is an increased association with autoimmune markers in the serum, higher levels of ALT at diagnosis, and a greater incidence of the PSC overlap with autoimmune hepatitis. These patients may also have a greater likelihood to have small duct PSC, and the disease persistence of progression will vary with individual patients. Let me now focus on reviewing some of the unmet needs of pediatric PSC. Children and adolescents are expected to live many years, and as such, we need to have a better understanding of the clinical course of the disease over time. We need to have better understanding of what complications they have and develop strategies to better monitor for those comorbidities. We have made some progress in this topic as illustrated by a collaborative multi-center international effort led by Dr. Deneau from Utah, published in Hepatology, in which he evaluated a total of 718 children and adolescents with PSC. You can see that population had about 1/3 with autoimmune hepatitis, 2/3 with IBD, and documentation of small duct PSC when the patients had liver biopsy in about 13% of them. Notably, event-free survival at 7 years was present in 70% of the patients, but that dropped to 53% at 10 years after the diagnosis of PSC. Interestingly, at 10 years of disease, the greater complication was portal hypertension at 38%, followed by biliary complications at 25%. If the patient had one of those complications, they had a lower survival at native liver for about 2.5 that was present after about 2.8 years from the time that they developed the complication. And for biliary complication, a little later, in about 3.5 to 4 years. And cholangiocarcinoma was present in only 1%. Much more recent study by the same group now looked at over 1,000 patients and tried to review their data to develop a strategy to look at prognostic and risk stratification for those children. They developed what's now called the SCOPE index for sclerosing cholangitis outcomes in pediatrics. This was developed by looking at all available laboratory and clinical features, stages of disease at diagnosis and blood test, and then the types of complications that they developed. You can see here the scope index is made of 5 parameters. The first, serum bilirubin. A specific point is given based on how high the serum bilirubin is. The same for albumin, platelet count, gamma GT. For cholangiopathy, the patients received 1 if there was large duct involvement. They were then grouped into low, medium, and high index based on the numerical value that is added from this table. In this graph, you see the proportion of patients that remain without complications. And you can see here that is clearly differentiating the group with low risk, medium, and high risk. Now, this is very important if one thinks about designing a study or an intervention in those studies. The intervention should probably focus on those patients that are likely to have a high risk, because between 1 and 2 years of age, whatever intervention you expect has to really represent 20% of those that do not have a complication. This is important because you can use this information to try to develop a power calculation and know how many patients you need to enroll, but also how long you need to wait before you can have a endpoint that is measurable. And you can see that if you are in the low, medium risk early on, it will take 4 years to have only a 10% change. So very important paper. How about unmet needs that relate to the impact of the disease in growth and development? What is important for the child and the adolescent? We need to have better patient-reported outcome metrics in which support systems are needed at school, in extracurricular activities, in social activities. There is one paper that already began to address that. It was published in 2018 by Trevisoli and others. They assessed 43 patients with autoimmune hepatitis. About 20% of them had sclerosing cholangitis. And they identified negative factors that impacted psychosocial quality of life. It's whether they had symptoms, whether they had extrahepatic autoimmune diseases, and actually if they disliked taking medication. Yes, this is important for this patient population. And finally, we need more effective treatment so that we don't give the patients treatments that are available. Instead, we give them treatments that are needed for the patient. This is the treatment armamentarium that we have. Urso has specific doses, and we are concerned about using higher doses. We pay attention to bone health and promote and provide vitamin D. And we learned earlier today the ongoing trials look at other agents. And of course, the use of antibiotic as a current theme of investigation. Finally, there is indeed a huge unmet need in pediatric PSC. We have no proven treatment. We don't yet understand what causes PSC, what triggers the inflammation. Does the inflammation start the disease? What is it that drives fibrosis? What is the role of the microbiome? We need better non-invasive biomarkers, perhaps with new MRI modalities, and the use of minimally invasive biomarkers to monitor disease progression. Clearly, we need patient-reported outcome measures, and we need greater participation in clinical and collaborative studies. I want to thank all the organizations that committed to funding studies on PSC, and thank you for the opportunity to present this data with you. Thank you very much.
Thank you, Dr. Becerra, for outlining the special clinical issues that pediatric PSC patients face and for highlighting the path forward for us. We will now hear from another set of patient testimonials. We will hear from Beck, Alex, Richard, and Jennifer. Please take it away, Beck.
Hi, I'm Beck from Melbourne, Australia, and I'm 22 years old. I was diagnosed with primary sclerosing cholangitis just before my first birthday and with ulcerative colitis 7 years later. I suffered many of the common and not so common complications of end-stage liver disease, including hepatopulmonary syndrome and varices around my ileostomy that would bleed up to 400 mils at a time. I was transplanted at age 13 after being officially listed for 18 months, with only a few weeks left to live. Post-transplant, I am doing quite well, but still live a modified life and with the knowledge that I may have recurrent PSC. Being diagnosed so young, I don't have any idea what it's like to be healthy, so it's hard to know exactly how PSC has affected me. Growing up, I was always the smallest in my class by a landslide due to stunted growth. I always got fatigued a lot quicker than my peers. I could take pills by age 4. I often thought something was common knowledge when it wasn't, for example, what a liver is. I've made a lot of sacrifices because of my health, and so has my family. When you spend your childhood and teen years sick, you really have to learn to manage your expectations. Dreams were shattered and then changed. I wanted to be a famous actress, but my health said no. So then I wanted to act in commercials. Still no. Okay, maybe I'll be a makeup artist in movies. No. Right, what about if I volunteer backstage at an amateur theatre company? It's hard work, but doable, and I love it. Every single thing in my life went through that process. Nothing was plan A or B or even plan O. You make the best with what you're given. Why do I put so much effort into campaigning for primary sclerosing cholangitis? Because we need awareness. Awareness for the disease, but also for how much it varies. PSC is so unpredictable. I work hard because we need a cure. Even a treatment would be great. Did you know that there are 0 treatments for PSC? We treat the symptoms, the itch, the varices, pain, fatigue, infections, and so on, but we don't treat the cause of all those problems because there isn't anything. So that's why we need to work hard to raise awareness and funds, to get treatments and one day a cure. It's too late for me and the damage PSC has caused my body, and we can't bring back those that we've lost. But I want to change the future for others with PSC. I want them to have hope and options in the medical realm. Thanks for listening. Bye.
Last year, my son was so excited as we waited together at the bus stop for the school bus to take him to kindergarten for the very first time. He had this enormous backpack that, even on its tightest setting, overwhelmed his little 5-year-old body. For other parents, it seemed like that iconic moment as each of their children climbed the bus steps for the first time into a more independent childhood towards graduation from high school. When it was my son's turn to climb the steps, I knew my worries were different. I fought a numbing, crushing sadness as I wondered whether his footsteps will lead first to his driver's license or to a liver transplant. I wondered how many stays in a hospital he will have to endure as his illness progresses during this chapter of his life, his childhood years. That huge backpack that should have been a symbol of bittersweet independence struck me as a symbol of the burden of disease that he carries. A year before, we learned that he has PSC. For months, we knew something was really wrong, and all of my worries centered around diseases for which there are treatments to explore. And yet, the final diagnosis was for a progressive disease with no treatments and no cure. My son suffered from interminable itching. We just thought he had dry skin. He suffered from nausea and bouts of vomiting, and we thought he just caught a lot of stomach bugs. At his most acute suffering, He doubled over from abdominal pain at his own 4th birthday party. At that time, he could not play or sleep restfully. Next, he began suffering symptoms of ulcerative colitis. Still, he has had an uncomplicated course so far. Recently, my son learned to swallow pills. He was so nervous to try, but the look on his face was one of pride and pure joy when he successfully swallowed 4 pills that he understood absolved him from a chalky mixture that he had otherwise been dutifully choking down. I'm so proud of his positive attitude, and I'm so saddened because I understand that this represents the beginning of incalculable pills in his future that relate to management of symptoms but don't relate to a cure for PSC. It is hard not to wake up every day and worry that my little boy may never be better than he is today. After all, time marches on, fibrosis continues, and complications eventually will happen. As a parent, I cannot accept this. I feel like this rare disease is unfolding like a time bomb inside of my child, and I am worried about what is yet to come. I'm fiercely private about my son, and the only reason why I'm speaking with you today is because we must advance PSC research and find a cure for all of those suffering today and for those like my son whose suffering lies ahead.
Good afternoon. I've heard that losing a child is the worst possible trauma that one can experience in life. And I've come to as close as that experience as I ever want to be, not just once, but twice. My name is Richard Ian, husband, father to 2 great kids, and most recently a grandfather. Because of a PSC, we've been on a 10-year journey that has scarred our family for life. Just speaking here today brings all those emotions just roaring back, and the pain I can still vividly remember. Our journey begins with Matthew and I at the gym. As I was spotting weights for him, I looked down and I noticed his eyes were yellow and his body was jaundiced. It took the doctors almost a year to know that it was PSC. It was a bittersweet moment because we finally knew what the cause was, but we were devastated because it was PSC. You see, we knew without intervention of some sort, it meant certain death for Matthew. Over the last 10 years, my wife, my kids, and I have been and experienced some of the deepest and darkest moments one could ever imagine. My worst moment was on May 12, 2010, when Dr. Grant walked in. He looked at Matthew and he said, "Young man, you have 6 months to live unless you find a live donor." I can still hear his voice, and I can still see the look of total devastation on my wife's face. So 10 years ago, Matthew was 16, I donated 71% of my liver. This was the worst day in the life of my wife, as she experienced fear, despair, and total helplessness as both her husband and son were under the knife at the same time at 2 different hospitals. This has left her scarred forever. We almost lost Matthew that day. I still believe to this day that Matthew is alive because of his inner strength and never giving up attitude. Over the next several months, Matthew's life returned to some semblance of normalcy. He graduated high school. He got his driver's license. He got accepted at university. He was loving life and enjoying it just like any normal teenager should. And then just 2 months after starting university, Matthew got sick again. The disease got very aggressive. And within 16 months, he was sleeping 18 hours a day. I was distraught and I was in despair. I didn't believe he was going to make it. Matthew must have seen the look of fear and despair in my eyes, because one day he looked up at me and told me, "Dad, I'm not going to die. So just 2 months after that day he told me he was not going to die, Matthew got a second lease on life. He received a liver from a deceased donor. Fast forward to today, Matthew is living his life and chasing his dreams and making the most out of each and every day. However, he lives with the uncertainty that comes along with PSC. He doesn't know, as healthy as he is today, whether he'll wake up tomorrow morning again fighting for his life. I would love to go to my grave knowing that there was a cure that gave Matthew a fighting chance. I would give everything I own and my life for such a drug or a treatment. Please, we cannot let this bright light or other PSCers suffer and face death. We need to find a cure and a treatment for this nasty disease called PSC. Thank you.
Hi, my name is Jennifer Sims, and I am the mom of a pediatric post-transplant PSC patient. After years of trying to figure out why my 8-year-old son was not meeting developmental milestones, constantly itching, nauseated, and vomiting frequently, he was diagnosed with PSC and Crohn's disease. Over the next 7 years, he was hospitalized more times than we can count. He experienced severe pruritus, and his skin was always broken, bleeding, and infected. We literally tried every therapy under the sun to try to help his itching. He had 6 or 7 ERCPs with stent placement in his bile ducts. No relief, never. It was awful. It was excruciating. And as a parent, it is the most helpless feeling in the world to watch your child suffer, knowing there's nothing that you can do to help. My son also suffered from debilitating fatigue, severe insomnia, and failure to thrive. He missed 1.5 years of school because his symptoms were so bad. He even had to repeat a grade. He fell asleep in class, missed school because he was too tired, and missed out on many social events because of his all-consuming fatigue. He was constantly losing weight and had to have more rounds of TPN than I can count. He was literally wasting away. At 13 years old, he was listed for transplant, and our family was very hopeful as we began the waiting game. Exception points were applied for and granted along the way because the MELD system is extremely unkind to PSC patients. We agonized over the option of a living donor. We were torn by the thought of putting someone else's life at risk. It was one of the most difficult periods of our lives, but we reached the decision to proceed because it was clear our son couldn't wait much longer. He was matched with an altruistic donor and surgery was scheduled. About 6 weeks before surgery, we got a call that he had been matched with a deceased donor, and he had his transplant on May 14th, 2018. The journey before and after transplant has been excruciating. My son essentially lost his childhood. He has cognitive delays because of the extensive liver damage. His transplant recovery has not gone smoothly either. He is 2 years post-transplant and has had 6 traumatic episodes of acute rejection. Each rejection episode involves a risky liver biopsy, days in the hospital, IV and oral steroids, all with distressing side effects. He has blood work so often that his veins are completely scarred up, and it often takes multiple painful attempts to find a good vein. We hoped that our lives, which were previously filled with frequent hospitalizations, procedures, and blood draws, would be more normal post-transplant. His transplant has not been the cure we had hoped for. He still feels awful much of the time. He takes more medications now than ever before. But we are hopeful. We are hopeful for the future, and we are hopeful that new therapies will come along that have a real impact on the symptoms of this dreadful disease. We are hopeful that patients won't have to hang their hats on a transplant that may or may not improve their quality of life. We are hopeful for a cure. We are begging for your help. We need you to help us find a cure.
Thank you, Beck, Alex, Richard, and Jennifer. We are indebted to you for sharing such intensely personal and emotional experiences. Once again, we are now going to turn to the Our Voices survey results to add the perspective of over 800 patients who responded. Please welcome Megan Carey, Executive Director of PSC Partners, to discuss survey results relevant to the pediatric experience. Take it away, Megan.
Thank you for the opportunity to present some of the PFDD survey data about pediatric PSCers. Earlier, Dr. Becerra discussed the differences between pediatric and adult PSC, but the next two slides show similar survey responses for pediatrics and adults. Note our pediatric numbers are small, with 37 patients, which is a gap despite efforts to encourage pediatric participation. Yet, the results are notably similar for the question asking, how much did IBD symptoms impact how you feel and function when your PSC was at its worst? The pediatric responses are in the pie on the left and the adult responses on the right. The red pie slices show the percent of respondents with IBD for whom IBD symptoms had a major impact on how they feel and function. Although many of us have heard that the IBD in PSCers tends to be less severe than IBD patients without PSC, what is surprising to note here is the tremendous impact of PSC IBD at its worst on children, teens, and adults. Next slide, please. This slide shows the frequency of IBD symptoms in the past 6 months, again with pediatric on the left and adult on the right. In this small sample of pediatric PSCers, no one identified having symptoms all of the time. It's positive to see reported symptom control in the past 6 months. Note that over 40% had no symptoms and over 80% had symptoms either sometimes or not at all. Sometimes we see clinical trials excluding PSC patients with IBD. If IBD is well controlled, why are we excluding it, knowing that over 70% of PSCers live with IBD? Next slide, please. On this next slide, let's change our focus to medications for PSC symptoms. The survey asked about various medications known to be used by PSCers. In particular, please focus on Urso dioxycholic acid and oral Vancomycin, two drugs that are not approved for PSC. Urso is being used in nearly 80% of the small sample of pediatric patients and over 50% of the large sample of adult PSC patients. Since we have no treatments available to us, it's not surprising that such a high percentage of patients are willing to take a non-approved drug. Although past clinical trials have shown conflicting efficacy results, a certain subgroup of PSC patients report that they feel and function better on Urso and have decreased liver function tests. We'd like to know how to better characterize who responds. Use of oral vancomycin in pediatric PSC has been rising due to publication of a study of a small number of cases and more recently published results of a small clinical trial in pediatric PSC patients. A randomized clinical trial in adults is underway, but nothing specifically for pediatrics. We can see that in our 37 pediatric patients, 32% reported taking vancomycin. Shortly, you will hear from some patients, many of whom reported improved symptoms and imaging. Anecdotally, there seems to be a subset of pediatric patients who report improvement, seemingly more so than adults with PSC. If that is so, why might pediatric patients respond differently? More clinical trial data with larger numbers is needed to both demonstrate efficacy and to better characterize who responds. Clearly, with no approved treatments, the need for further research with large diverse populations for all ages is a necessity. Next slide, please. We welcome more opportunities for the pediatric PSC community to participate in clinical trials. To succeed and improve the lives of PSCers, it is critical for us to develop working relationships that put the voice of the patient front and center. Thank you. Now back to you in the studio.
Thank you, Megan. Let's turn to live polling again, please. If you've just joined us, please join the live polling if you are a PSC patient or caregiver of a PSC patient. You can either return to the polling tab you previously used or to launch the polling, find the green button that says Live Polling at the bottom of the page under the live stream window. This will open a new tab in your browser, or pick up a mobile device and go directly to pollev.com/PSC PFDD. Okay, our first question is, which of the following have been challenging for the pediatric PSC patient? Select all that apply. Physically demanding activities or sports, less physically demanding activities for play, fun, and exercise, school or work responsibilities, social time with family and friends, help with household chores, reading, games, hobbies, and crafts, no unexpected challenges. So as the responses come in, we are seeing that physically demanding activities or sports are a quarter of the respondents are finding those challenging, as well as school or work responsibilities.
Right, it's that combination of fatigue and everything else that comes with it.
And only 2% of the respondents said no unexpected challenges. So these patients are experiencing challenges from their PSC. Can we go to the next question, please? What has been the pediatric PSC patient's experience with Urso and/or Vancomycin? Select all that apply. A, taking Urso now. B, tried Urso and stopped. C, never taken Urso. D, taking Vancomycin now. E, tried Vancomycin and stopped. F, never tried Vancomycin. G, taking Urso and Vancomycin now. H, prevented from taking one or the other by cost or access. So this is lining up with what we saw in the survey results as well. Most of our, well, not most, but many of the pediatric patients are taking Urso, and some are trying Vancomycin or taking Vancomycin.
Right.
And there are 2% who are saying they've been prevented for some reason from trying. Thank you. Could we go to the next question, please? What might encourage you to volunteer the PSC patient for a pediatric clinical trial? Select all that apply. A, enough information about the trial. B, safety profile of the trial drug. C, recommendation from the child's physician. D, option of home health care to replace most clinic visits. E, no invasive procedures beyond the usual routine tests. F, I'm already motivated to enroll my child. Or G, I would never enroll my child. So people are looking for information. 30% of the respondents would like enough information about the trial. Similarly, safety profile of the trial drug. Nobody has responded that they would never enroll their child.
Right. That's very, very encouraging. And sometimes, it's very difficult to find the right information.
It is, yeah. Thank you so much for participating.
Right.
These results will all be part of the Voice of the Patient report. You can leave the polling tab open and simply return to it when we launch the next polling section. Dr. Miller, the next live panel, is ready to join us to continue the discussion of the consequences of lack of treatments for PSC. Remember, viewers, to join the conversation, please submit online comments, or you can call in to 703-844-3231.
Great, thank you, Mary, and welcome to the panel. We have Chelsea, we have Afsana again. We heard from you earlier today. Great to see you again. We have Willie, and we have Richard, whom we also just heard from on the panel, talking about your son, Matthew. Afsana, let's go to you. Remind people who you are, since we've had a lunch break since you first talked. Tell us where you live and what stage of the PSC journey you're on.
Hi, my name's Afsana. I'm 21 years old now, and I was diagnosed with PSC at 16. Mm-hmm. And then a year later, I was diagnosed with Crohn's disease, so at 17. But I've actually been a bit of a pediatric hospital lifer, as I call it, because I was diagnosed with arthritis at 15 months old.
Right. You have tried some interesting treatments because of lack of things you could find to help you. Tell us a little bit about what you have tried.
So I've tried a lot of treatments for my unbearable itch, including Urso, Vancomycin, cholestyramine, both the pill and powder form. But all of the options I've tried either didn't produce any effects at all, or was the complete opposite and drove my other chronic illnesses to a severe point of unbearable side effects. So I had to stop all of those medications, and I was offered the opportunity to try a treatment called plasmapheresis, or PLEX. And that's when they take all the blood out of your body and run it through a machine so that they separate the plasma from the rest of the blood components. And the plasma is the part that has the bilirubin inside of it. And the machine filters it out for you because my liver can't do it properly. So I tried this treatment for about 3 months, and that was 3 times a week, 5 hours each. So because of the extensive time commitment, I did have to leave school. And I also decided to leave at the end of my 3-month trial because I felt that the downsides of the treatment outweighed the benefits I was getting from it. And I think that some of the downsides that I wanted to touch on quickly were the fact that I had to get a port, which was a very painful experience for me and caused a lot of PTSD, as well as fluid and electrolyte depletion. So I was feeling nauseous and vomiting a lot, fainting or being dizzy a lot. And there was a big component of fatigue that came from the treatment as well, on top of my PSC fatigue. So that wasn't ideal for me. Then obviously my quality of life went down when I had to leave school and be fully committed to this treatment option. And I felt a little bit mentally down because of that. And in the end, I did decide to leave, and I'm not on any itching treatments right now. But during PLEX, my friends and family did say I looked and acted like a walking zombie. And to be honest, I also did feel like that a little bit. So in summary, I'm kind of glad I stopped, even though it did give me a bit of a relief, around 10 to 15% maybe of benefit I got out of it, but it wasn't enough for me to stay with it.
Well, you're very brave, and we commend you for trying. Plasmapheresis is quite a drastic thing to try, and really emphasizes the dire need to have something that will stop the symptoms. And it must have been very disappointing for you to have none of the other treatments work for you. But hang in there. We're working on it. Thank you for sharing those stories. Richard, we just heard from you and your relationship with your son, Matthew, and what it means to be a father with a PSC patient, a PSC child. Matthew is older now, and he is doing some very interesting things. What else would you like us all to hear today? What would you like the FDA and the industry sponsors to hear about the kinds of treatments that we need?
Well, first of all, there's no guarantees in life. Good morning, everybody. There's no guarantees in life, and living life with uncertainty is normal for everybody. But having to live with the uncertainty of whether the PSC gets active, and because today there is no cure, there's no other intervention than a transplant that's not permanent. So living with that uncertainty is very, very difficult as a parent, and very, very difficult as I can't imagine what it's like as somebody who has PSC living with that, knowing there's no cure and no intervention that could save your life. It's almost like a death sentence.
Right, right. Thank you for that additional insight. And we might circle back to you, but we, as you know, we also want to get in some voices from people that will be calling in. Chelsea, this is a big day for you. Welcome here. Tell us a little bit about yourself. You're on mute. You need to unmute yourself. There you go.
Good now? Unmuted?
Yes, we
Okay.
can hear you.
Hi, I'm Chelsea. I live in Massachusetts, and I'm from South Louisiana. And up until I moved with my fiance to Massachusetts 2.5 years ago for better treatment, I was treated by doctors 4 hours from my home in Houston. I was diagnosed with PSC when I was 6 years old. I've had ulcerative colitis since I was 20 months old, but I wasn't diagnosed with it until I was 4 years old. In addition, I have autoimmune hepatitis, which was diagnosed when I was 9. I am 24 now and have had cirrhosis for years. I've been listed for transplant for 4 years and in 3 separate regions. And my mom is going to be donating a piece of her liver to me on the 26th, on Monday. So I just had a hepatic venogram yesterday, so that's why you see this little dressing on me. And we had a bunch of other appointments and tests yesterday, so now we're just...
Right. So again, very brave of you to be here with us today, right in the middle of all of this preparation. Tell us a little bit about the impact of the disease, the IBD, the autoimmune hepatitis, on your mental health and on your student life and on your life in general.
Sure. So as you might imagine, growing up with PSC and these other autoimmune diseases was extremely difficult. I missed a lot of school because I was in the hospital or because I was sick. 4 hours from home in Houston, but my parents kept bringing me there because they were the only ones who knew what I had and knew how to treat me. I can't remember a time in my life when I was healthy. That doesn't exist for me. I've taken tons of medications my whole life. I've been poked and prodded my entire life, separated from my peers, and hospitalized for various lengths of times. Was neutropenic for a long time as a child. As a child, I was separated from my peers, and that causes a divide when you're young. You know, I'd go to school. Especially, I remember in kindergarten, I'd go to school with my IV pole. I couldn't go out to recess. I would miss, weeks, months because I was sick or it was flu season and would be at home. The doctors didn't want me to be exposed to other people outside of my home. Even now, I wear masks. Well, before the pandemic, I wore masks during flu season and sometimes have to stay home if there are others in my class who are sick. There are a lot of things that I missed out on because my immune system could not handle being around other people. And I was bullied often as a child. I didn't have a solid group of friends until I was a teenager in high school. Children don't really like what they don't understand. And I'm sure it looked funny, being hooked up to an IV pole and yellow, but it wasn't just that. It was also the fact that I missed a lot of social interaction with them. Being hospitalized or being home sick. I felt like I was constantly the new kid in my own school district, and I was always othered. Sat alone at lunch. A lot of times, everybody thought that something was wrong with me, that I was contagious, despite my best efforts to explain that I wasn't, And growing up sick is painful for so many reasons. Everybody talks about the physical aspects of PSC. And I can promise you, I have experienced my own share. I am very symptomatic PSCer. Those things are a huge problem in their own right. But I'd like to talk, like you said, about the mental effects of having PSC, how it rips you apart inside and makes you question your own existence and how it can make you not want to live anymore. I sorry, I'm getting a little emotional. I feel like I didn't really have any help as I developed an eating disorder and anxiety and became severely depressed, and thought about killing myself. And through all of that, I was just a little girl. I was a child, and I had no one to talk to about it because of the stigma surrounding it. I was brought to counselors and they just labeled me as a worrywart. No one ever really helped me. And I thought that it was something inherently wrong with me and that it was my fault. It took me a long time and a lot of mental health professionals to get to a place where I'm okay. But I still struggle today. My definitive diagnosis is PTSD. I have PTSD from the trauma that a life with PSC causes. And if I leave you guys with anything, I just hope that you understand that this disease is so debilitating. It ruins people's lives in more ways than one. Thank you for letting me.
Thank you,
talk.
Chelsea. Thank you, Chelsea. We wish you all the best for the big day on Monday.
Thank you.
And thank you for sharing so honestly with us. Willie, you're father of a daughter with PSC.
Yes, I am. And hearing Chelsea talks, it takes me back. My name is Willie. I live in Richmond, and my daughter was diagnosed when she was 17. I remember the day she was diagnosed. It was, as Richard said, like a death sentence. We were told there's no cure. She's at increased risk, which you guys have heard, for developing cancer, and there you go. I will say, in essence, we were lucky because her primary physician recommended that she go to a doctor that specialized in PSC, just happened to be right around the corner, so she was diagnosed early. But it was very hopeless, and the mental attacks the family as well. We went on this journey seeking information so that we went through all the stages of grief and eventually came to the stage where we wanted to fight. We started losing the battle, and my daughter ultimately received a liver transplant that we celebrated about a year ago, her receiving a liver transplant. And fingers crossed, we're going to keep celebrating. She was actually recovered very quickly, and she's doing very well. But we're continuing to fight, and we hope that there will be a drug, because our fear is that it will come back, and that she would go through everything that everyone has been talking about again.
Right. It's this uncertainty, right, that stays with you continuously. And the reason why we need treatments so urgently for this. You have a very close relationship with your daughter. Would you just share with us one of your favorite activities with your daughter?
Well, when you use the word favorite, it's her favorite activity, and I enjoy spending time with her. So we go and we have our nails done.
Wonderful.
Whether or not I enjoy it, that's irrelevant. She enjoys it, so I enjoy it. So,
that's wonderful.
And I usually get the clear polish.
That's good. That's good. Yeah. Thank you for sharing that. We need to appreciate all the different little parts in life that we have to deal with. We do have a caller ready to talk to us. We have Amanda from Wisconsin. Amanda, are you ready to speak?
Yeah, I'm ready.
Wonderful. Go ahead, please.
Hi, my name is Amanda. Like you said, I live in New Bern, Wisconsin. I'm 15 years old, and I was diagnosed with PSC, AAH, and IBD 5 years ago.
Wow.
I'm calling to talk about how PSC has affected my life as a teenager. To start, it's an honor to speak with you about PSC drug development. It has come a long way in the past decades, but it still needs to go further. Luckily, my diseases have been in a relatively good state of remission, and I thankfully have not had any symptoms that have affected what I can and cannot do yet. My physical symptoms include nausea and itchy skin. Even though I have a fear of throwing up, I still dislike itching more. I've ripped through my scan countless times, and having these diseases affects my mental and emotional health. My emotions usually conduct how my physical symptoms play out. So, like, if I'm nervous or irritated, then I usually find myself itching and scratching more. My mental health is also not the best because I constantly live in fear about what is to come, and I tend to look on the downside of things. So, to me, it is of vital importance to fund the research needed to find other possible treatments and hopefully a cure for this disease.
Right, Amanda, that is so important for everyone here to hear. And thank you so much for calling in and telling us about your journey, just a little bit about it, but we really, really appreciate that. So thank you, Amanda. Let's go to Julianne from Minnesota. Julianne, are you with us?
Can you hear me?
Yes.
Yes, I am. Can you hear me?
Yes.
Let me just pull up my note here. Yeah, my name is Julianne. I live in Minnesota, and I'm actually a post-transplant PSCer. I'm 37. And I've had a pretty, well, first of all, I just want to thank the FDA and, everybody listening for actually agreeing to this forum and for PSC Partners putting it together. I hope that those that aren't in the PSC community or involved with PSC Partners understand how important this PSC Partners is to us as patients and to our families, having that support and the power of community. It really, really changes our lives in fighting the disease. So I hope you understand the power of this community and what we're striving for. But I want to speak to the strength of the young PSCers. One really high point of my life in the last 6 years after my own liver transplant has been able to mentor the teen patients at the annual PSC Partners Seeking a Cure conferences. And, you've probably been inspired already by hearing them talk throughout this time. I know all of them and that have spoken, and they're just incredible young people. And, from my own personal experience, I was diagnosed with ulcerative colitis at 19 when I was in college, and I was an elite athlete. And being diagnosed even with ulcerative colitis and PSC later at 25, I felt like when I was diagnosed with PSC, I had at least had the opportunity to have experiences and grow up and have a normal social life and, have some of those experiences and get going in my adult life. And PSC really robs these young people of those opportunities. I will tell you, it's so inspiring every year. I think everybody at the conference is inspired when they hear these teens speak. And I know that them getting together at the conference every year is huge for them.
Right.
To just reach out and have somebody understand what
it's so important.
they're going through.
To have that support.
It's so unique.
That networking.
Yeah.
Right.
Yeah, it's so unique amongst their age group and everything like that. So it's a strong point for them to be able to connect with other people that's their age. So
Julianne,
the strength of these young people.
Thank you so much for what you do at the PSC conferences and everything else in your support for pediatric and adolescent and teenage patients. We want to also hear from a few comments. So thank you, Julianne, and we will now go to some comments that Mary will read.
Thank you. Yes, we have many comments coming in. I'd like to start with Cynthia from Arizona. Cynthia is a parent of a pediatric patient, and she says, my daughter was diagnosed with PSC in 2012 at the age of 15. She has taken vancomycin therapy now for over 8 years and has a completely normal colon and liver. She has lived a normal life since starting oral vanco, graduated undergrad, and graduated school with a degree focused in gut microbiology, and is now a gut microbiome researcher. Vanco has shown efficacy in numerous patients worldwide if a number of variables that impact this therapy are managed properly. Her question is, why are we not focused more on understanding why it has shown efficacy in these patients?
That is such an important question. Again, so much heterogeneity in patients, and we need to know more about why Urso works in some and why vancomycin might work in some. Additional comments?
Yep. Marnie from Alberta, Canada, another parent of a pediatric patient. Our 8-year-old son was recently diagnosed with AIH, PSC overlap. It has impacted our life as he has not been able to attend school while on high doses of immunosuppressant, and his fatigue and aches and pains have prevented him from playing sports, an activity he loves. Sarah from Texas says, my daughter has trouble swallowing the huge vancomycin pills.
Right, a real issue. Right, right. Would any of you like to respond to some of these comments in terms of what it is like to, maybe you, Afsana, you've taken so many medications that you've tried for your itching and other symptoms. What is it like for a child to have to swallow big pills?
I actually did struggle with it a lot at the beginning of my childhood, but I found that if I put a pill in a mashed banana bite, it helped me swallow it because I was pretending like it wasn't there.
Right.
And then eventually I was able to do it without the mashed banana or applesauce or some sort of mashed food. And then I graduated to taking it with juice or a smoothie, something a little bit less solid, more liquid. And then I graduated again to water. And now I can even do it without liquid. But I do agree that it was a struggle swallowing the Vanco pills and all the other huge pills that I've tried. But it's just something that I've learned to live with and deal with.
Right. As we develop new treatments, we have to remember they need to also be appropriately formulated for children. Because we have heard that some children start receiving medication at a very young age. Richard, let's go back to you now and talk about Matthew and your view of how treatments for him could be so much better if it weren't for a transplant.
Well, as I said in my opening introduction, just the ability, there's lots of diseases out there, but if we just have a cure or treatment, I think it puts a completely different perspective on that journey and how you deal with life. You've listened to 3 or 4 different conversations already, and it's been a decade for us, and it just brings all the emotions back. So, I can't imagine what it's like as a patient, but I know as a parent, having to watch your child and you can't comfort them or protect them, that's a problem. For me, I'd do anything for a cure. I give my life. So, and I think that the drive needs to continue to find cures or treatments for this. So it's not a death sentence for young people with PSC or anybody with PSC.
Right.
We talked about the community today, and there's just so many people we've lost, and it's very difficult.
Right. Chelsea, what is your biggest anticipation for this big day coming on Monday?
My biggest anticipation, or biggest worry, you mean?
Yeah, worry or excitement, or it must be an amazing thought.
It's a whirlwind of emotions, kind of a roller coaster. I'm excited, but I'm also incredibly nervous for recurrent PSC or possibly autoimmune hepatitis because I have both. I have the overlap syndrome. And I know that I should be focusing on just recovering, with the new liver, with my mom's liver. But it's really difficult not to anticipate something like that happening because it seems like it happens to so many of the people that I know. And it's scary. I'm excited and nervous, but I'm mostly scared.
I don't blame you. That is, a liver transplant is a huge thing.
And I've, anticipated this my whole life. Since I was a little girl, I've known that I was going to have one.
Right.
I've lived a lot longer with my own liver than they thought that I would. originally. So
Right.
especially with both PSC and AIH.
And of course, you have to also, I'm sure you're also thinking about your mother, although
Yes.
she's probably telling you not to worry about her, but she's in a different hospital, and somebody's going to drive her liver over to you.
She's actually going to be in the same hospital.
Oh, in the same hospital, good.
Yes, but we're going to be on different floors,
Right.
so I won't be able to see her because of COVID. We'll both be isolated completely, no visitors or anything. So.
But I hear you're going to really get ready for school. I hear you have all kinds of school projects still underway.
I do, yes. I'm currently in grad school for library and information science. When I was a little girl and I had an IV pull and couldn't go out to recess, I would go to the library and shelve books. And once I stopped having my IV, I continued to do that. I fell in love with being in libraries. And so now as an adult, I'm getting my master's degree in library and information science. So I'm only able to take part-time class, one at a time right now. But yeah, I'm working on my degree, and my professor knows, and everybody's been really great at my university about it. But something to, look forward to.
Just know that you're such an inspiration for everyone, having gone through all of those difficult years as a younger child, and now as a young adult. You're a real inspiration to all of us.
Thank you.
And Willie, let's go back to you and really maybe explore that a little bit more about what it means when you're a father and you really, really are afraid that the dreams and ambitions of your child might not be realized, and what that means.
Yeah, there are a couple of things that I think about as a parent. I think about the things I said and did before I knew. When your child says, "I'm tired," is that just the typical teenager, meaning I don't want to do something? Or I have a pain in my side, I don't feel like eating. Is that I don't like the dinner that you cooked? And you think about that response after you hear she's been diagnosed, and you just feel horrible. And then there's I'm a father, and there's nothing that I can, and I'm a scientist, and there's nothing that I can do to tell her or reassure her that she's going to be okay. So it's hopeless, and it takes a toll mentally, I know, on the patient, but on the caregiver as well. And it's the day your life totally changes. There are some events where you can say, our world changed. And hearing their diagnosis was a day where our world totally changed, and we had to totally adapt and change.
Thank you, Willie. Thank you, all of you. Chelsea, Afsana, Richard, and Willie, for sharing these very personal stories. All the best to all of you, and we will hope to see you soon at one of our conferences again. Stay well. Thank you so much.